All right, welcome everyone. We'll go ahead and get started. Thank you for being here. My name is Leah McMahon, and I am the State PACE Ombudsman, which is the program of all-inclusive care for the elderly, and I work at Disability Law Colorado. I have been on the Colorado Coalition for Elder Rights and Abuse Prevention training. Can everybody hear me? I have been on the It's working. I've been on the steering committee for the Colorado Coalition for Elder Rights and Abuse Prevention for about 8 years now, and we do have some other committee members that are present. If you're in the room, can you please stand up? They're probably still working the table outside. We do have training evaluation forms, so hopefully you have taken that from the table outside. Turn that in and you will get your continued education credit of certificate outside as you turn that in at the end. We value your opinion and look forward to hearing what you would like to see in future training, so please remember to turn that in. You may ask questions at the end. Heather Badini will stop about with 30 minutes left so that we can have question and answer time. So please save your questions toward the end. Today's topic is understanding and dealing with the challenges of hoarding disorder. Our presenter today is Heather Badini. She has a license of professional counseling and a degree in clinical counseling from the University of Northern Colorado, which she received in 2009. She has worked in community mental health since 2001, where she began identifying and treating individuals with hoarding symptoms through community-based interventions. She currently manages the assessment department at Denver Springs, where she specializes in individuals that are in crisis situations. She is certified in addiction counseling and has been working with individuals with addictions since 2001. She received her Certified Addiction Counselor III certificate in 2007. She has been providing training in the community on hoarding since 2008 and providing consultation and education to professionals working with people who are hoarding. Heather's approach to therapeutic interventions includes cognitive behavioral therapy, motivational interviewing, and recovery-based models such as psychiatric rehabilitation. Please welcome Heather Badini.
All right, so can you guys all hear me okay? I have a very loud voice, so I don't always need a mic, so if it's too loud, let me know, or if you guys can't hear me in the back, just kind of flag me down at some point during the presentation. So today we're going to talk about hoarding. As we had mentioned, I've been working with individuals struggling with hoarding since about 2008. Of course, it started way before then. I started working in community mental health in 2001. And during that time, I did case management. So I did in-home case management and started seeing like what happens in homes when they start gathering things. And that topic started fascinating me. So I started kind of studying what hoarding is, what causes hoarding, all of those pieces. At that time, it was before the TV on TLC where they did the hoarding, like clutter truck stuff, all of those pieces. So it was very new. I'd never seen an episode of somebody's home and got to experience by walking into a home for the first time of being like, oh, wow, okay, this is different. So during that time, I'm excited to say now that we're in 2018, it's come a long ways. There's been a lot of research that's been done on hoarding, and we'll talk a little bit more about some other things that have happened over the last decade to help individuals that are struggling with hoarding tendencies or have a hoarding disorder. So we will get started. I will answer questions at the end. And again, if you guys have trouble hearing me, or anything pops up, just let me know. So this is just an overview of what we're going to discuss today. We're going to discuss what is hoarding. So again, I think what I kind of already talked about. Facts about hoarding, contributing factors. So like what contributes into why one individual may start hoarding and another individual doesn't, even in the same families, even in the same backgrounds, all of those pieces. Psychosocial factors and how that impacts people and the level of hoarding that they do. We'll also talk a little bit about treatment for hoarding. Then I'll show you guys all the clutter image rating scale, which is kind of one of my favorite scales to use. Dealing with resistance and treatment approaches, and safety factors. So, what is hoarding? So again, these are just kind of more, what are the signs that you see? So if I've not been in somebody's home, then how would I maybe know that some of the distress that I'm seeing, like in a therapeutic environment, or if I have family members that are coming to me and they're like, I'm concerned about a family member, I'm concerned things that are happening. These are good signs of hoarding. Now this does not mean that people that show these signs are all hoarding, but they are just kind of red flags to say what's going on in the home. So when people are hoarding in their home, they tend to isolate. They are not out in the public as much. They don't leave their home as often, and they don't socialize as much, because as we all socialize in our life, if we have friends, we want to invite them over, or we want to have social environments with them. And individuals that have clutter in their home do not feel safe bringing people into the home. So it then leads to that social isolation where they're not involving other people. They have a closed door policy. So we'll talk a little bit about this. This is what I call porch therapy. So if any of you guys have ever worked with people that have severe hoarding, they do not like to open their door. They do not want you to see the extent of what is happening in their home. They even close the door to family members. Some like red flags that I hear sometimes is, like I have a friend that says to me, you know, my sister-in-law stopped inviting us over for Thanksgiving, and now we're not even allowed in her home at all. And, you know, we're trying to figure out what's going on, and they're seeing this change in behavior. And so those kind of pieces can be red flags of like what's really happening for this individual and this family. Indecisive behaviors. So, you know, how many of you guys sit there and have like lunch? So your coworkers say, let's go to lunch today. Where do we want to go to lunch? And there's always that individual that's on there like, I don't know. I don't have an opinion. I can't decide. I don't know where to go. I had a friend like that. Every time I was like, I just need you to make a decision. So it's a very similar pieces to that in the sense that making decisions is a struggle for them. And we'll talk more about how that impacts the hoarding by that lack of ability to kind of be able to weigh pros and cons and identify why I want to do something versus not doing something. Then unlivable living spaces. So when you have people that are sleeping on their couches versus their bed because their bed's so covered with items that they can't sleep in their bed. They have dangerous walkways to and from. Their kitchen, they're not able to cook in their kitchen anymore because it's become a hazard. And then again, we'll talk a little bit about when they ask for help. So one of the things I always say is if somebody is asking for help in their hoarding, that is usually a pretty big red flag that it's very severe. People don't usually ask for the help when it's just a little bit. Types of items that people can hoard: paper, books, clothes, mail, personal items, containers, and I've also worked on some rare cases with animal hoarding. I've worked on a case where a woman hoarded mice in her home, and it became very dangerous for her and people living around her. But she had identified them as family members, and they had chewed through all of her wiring in her home, and it was a very interesting case to kind of work with her on that. Contributing factors to hoarding, again, indecisiveness, procrastination. So just because you're a procrastinator does not mean that you are going to become a hoarder, but it definitely does play into that part for individuals that do have hoarding tendencies. Fear. There's a lot of fear that goes behind that. It's fear of loss, fear of identity loss, a lot of different kind of fearful pieces that go into that. Perfectionism. This one always surprises people. How could somebody have perfectionism and then have their home become this like place that you can't even walk through? But what goes into perfectionism doesn't mean that everything is just exactly so and perfectly clean. I think that that's sometimes what I think of as perfectionism. But perfectionism is just that thought behind that of kind of like being methodical, being like very meticulous about what you're doing. When you work with people that are gathering items, they're very meticulous with what they're gathering. They're very like, this is why I do this. I always have to go and grab the free stuff. It's free. There's no reason why I wouldn't grab it when it's free. And that's a very kind of perfectionistic place. Avoidance behaviors, and then difficulty organizing tasks. So we'll talk a lot about this because the organization piece is so big into the actual treatment that we do with individuals. And I'll talk a little bit about that history of organization and everything. So some facts about hoarding. 92% of those that hoard have a co-occurring mental health diagnosis. That can be depression, that can be anxiety, can be bipolar, and other PTSD, so trauma, different pieces like that. It affects approximately 3 to 5% of our population. So that's a large percentage if we think about how many people that is. And many of the people that are hoarding, if you ask them if they feel like they have too many things or they're hoarding, the odds of them saying yes is very slim. Their insight, and actually in the diagnostic manual, how you identify their diagnosis is based on their insight into the hoarding. So some people might be like, yeah, I've got a little gathering problem, like I might collect more than I should. And then you go into their home and you can barely walk, and that's a lot more than they should. So that's one of the biggest pieces and barriers to treatment is their own lack of awareness of the problem. And then key elements of hoarding, again, it goes into that difficulty discarding, excessive acquiring, clutter, distress, and impairment due to hoarding. So one of the pieces is Boston University spent a lot of time they've been doing a study on the hoarding, and so that's where a lot of the research and a lot of the cognitive behavioral therapy interventions come from. They started that, I want to say, in 2000. They've been working on it for years, but I know in 2005 is when they really started using like group therapy and other approaches. So I have a lot of the Boston University research throughout here. One of the things that changed with our DSM-5 manual is that hoarding was added as its own diagnosis. It used to be covered under obsessive compulsive disorder, so individuals that had hoarding were identified as being obsessive compulsive. It never really matched. People that hoarded it did not always meet all the criterion for obsessive compulsive disorder. And so that's what treatment providers started identifying. This person really doesn't have the symptom criterion for obsessive compulsive disorder, but they're definitely hoarding and their home has become almost uninhabitable. So how can I treat this? The positive thing about it coming out in the DSM-5 and having its own diagnosis is that it means that therapists can start to bill for the services to treat this specific disorder. And the specific disorder treatment is very lengthy and long-term and costly. So that was a huge piece that now you've got therapists that are able to kind of bill for this disorder. And then, so like I had said on the DSM-5, it talks about the discarding, inability to discard items, excessive acquiring of items. All of those fall into that symptom piece. When it looks at severity, you're looking at level of severity based on insight. Do they identify that they have a problem? Do they identify that it's maybe a partial problem? Or do they have understanding that they have an issue that is now becoming detrimental to them? And so that's how, through the diagnostic manual, we work on that. But was good because now you start to see more things pop up of people being able to do hoarding interventions because it's now in there. All right, so contributing factors. One of the things is these are just some of the contributing factors. Because somebody has hoarding doesn't mean they meet any of these, but this is what you sometimes will see. So with the contributing factor of medical, Sometimes people, when they have had physical injuries or they have a medical condition that impacts their ability to care for themselves, doing ADLs, doing different pieces like that, it then impacts their ability to kind of discard and acquire and all of those pieces. So sometimes you see that with medical. You don't see it a lot though. What you usually see it for is when you have aging. So the elderly, as they age, you start to see their medical condition decline, and individuals that used to collect a lot of things now have an excessive problem because they don't have the energy to keep their home clean, and they don't have the energy to sort and organize what they need to do and what they've been doing. One of the pieces that most people don't realize is that people actually start hoarding tendencies at the age of 12. We see it a lot with our aging population, and I think the reason that it does come out more in the aging population is because their body has started to not be as active as it maybe once was. And so those tendencies that they've had since 12, lack of decision making, procrastination, not being able to organize things well, that's all stuff you learn as a child, right? Moms and dads hopefully teach us how to make decisions in our life, how to look at things that are important versus things that aren't important. And as we age, if we never learn how to do those things, then we don't learn how to do that with our hoarding, with our bringing things into our home. The other piece is brain injuries and traumatic brain injuries. Again, that affects the thought process of the organization, of how you sort things, how you acquire things, and what you get rid of. So sometimes you can see individuals with TBIs that do have the hoarding. Developmental disability. What we've seen a lot with this is the people will sometimes, in the hoarding, a lot of times identify kind of emotional attachment to their items. And so when you have somebody that's developmentally delayed, they become attached to items because it's easier than people, right? So again, with our isolation of individuals staying away, they've now become more attached to items than to other interactions with people. Same with people with developmental disabilities. Sometimes they become more attached to the item because that item is something they feel safe and secure and it feels good, and I'm going to collect more stuff that helps me feel good, and I'm going to keep doing that. Major mental illness. So one of the pieces with the psychosis, and this is a lot of where I first started seeing the hoarding piece, because I did work with our severe and persistent mentally ill, is the psychosis only comes into play when they're actually unstable. You don't see the hoarding for people just because they have psychosis. It's usually a sign that they're actually not on their meds and not doing well. So they start acquiring things in their home, and they do it very quickly. So with individuals that have schizophrenia, paranoid schizophrenia, those type of diagnoses and those type of symptoms, as they start to decomp, their homes can become uninhabitable because they may become paranoid. So I walked into one of my patients' home, and he had foil everywhere, wall-to-wall foil, foil on the windows, foil, piles of foil, mail piled from floor to ceiling. And I'd literally been in the apartment 6 months before, and it did not look like that. So it happened very quickly, and it had to do with the paranoia piece. And then the nice thing about that is once you get them stabilized on medications, that kind of goes away, and you can easily discard the items in the home, and it doesn't become as emotionally difficult or long-term as it does for individuals just struggling with hoarding. Major depression, of course, I think that goes into pieces when people are depressed. They're not able to get out of bed, they're not able to organize things, those kind of pieces. And then obsessive compulsive also does play a factor in it for individuals that have that, but it's not the sole factor for hoarding any longer. So again, mental health conditions, neurological conditions. So if any of you guys work with the aging population, individuals with dementia, starting to have those kind of tendencies that they may not have had before. So that's where I'm gonna see something a little different, right? They may not have been hoarding under the age of 12, they may not have been hoarding in their 20s and 30s, but for some reason, when they start having the neurological piece, that becomes a new factor in their life. And so you start to see things that you're like, wow, mom always liked things, but not to this degree, is what you'll hear people say. And that's because that neurological piece is actually impacting their ability to sort, organize, and discard and acquire. Family history. So again, going back to where people start to show symptoms of it at 12 is because it's a family history. If I am a mom that does not know how to sort and organize and help my child problem solve, then my child's probably not going to learn those techniques either, potentially. And if I live in a home where I hoard all of these things, my child doesn't know that there's anything wrong with that. They don't know that having all of these things and acquiring all these things is a problem. So definitely family history impacts hoarding. Trauma. Again, I think it goes back to that piece of individuals that acquire and identify with items because, again, they give them comfort, they give them, they just kind of bring in this like safe place for them. So if you have individuals with trauma, it is much safer to hold on to an item than have to worry about somebody hurting me again. Another piece of this too is trauma. A lot of our elderly population that lived through the Depression, that was a really traumatic experience for a lot of people. And so that's that excessive acquiring. I've gone in and I've worked with individuals that they're like, you just never know when you're going to need this. You never know when I might need this. Please don't get rid of that. And I think a lot of that goes back to the trauma. And it might be from the Depression, or it might be from living in a home that didn't have all their needs met, right? So they didn't have parents that had food on the table on a nightly basis. So that can be any age. And all of that will impact people's excessive acquiring and inability to kind of let things go. Again, feelings associated with possessions. The reason I really focus on that in here is because it's so critical to understand when you are going into somebody's home and you are working with somebody to try to help them kind of manage their home for it to become a safe environment for them to stay in, that when you start talking about items in the home, you need to understand the feelings that are attached to those items for the individual. So you don't want to walk into a home and be like, oh my gosh, you've got all these papers. Why do you have all these papers? Like, there's no reason for these papers. We have to move these papers. And right there, you've already isolated and ostracized yourself from the individual who's like, you don't get me. And these are not just papers. And these are important papers. And they have an impact on my life. And you're minimizing that. So I will keep going back to that because it's a very important piece to remember. Again, social skills, social identity, those kind of go a little bit together. It goes with the isolation, identity pieces. And as we talk about some of the treatment interventions, you'll see that they actually start to identify themselves with their belongings. So when I'm going in and I think that, oh, we're just going to get rid of all these like teddy bears. You've got 25 teddy bears in this one spot. Nobody needs 25 teddy bears at 50. Although some people may disagree with that. But I might want to go in there, but the person has actually identified with those teddy bears. So when I say things like that, I'm really saying it about them. So they're hearing me say that they're not important because this is part of their identity and who they've identified with. And so it's just really important to understand that attachment that they get to the items and the fear that's associated with letting them go, because that fear taps into who they are as a person. And so when you're looking at treatment and when you're looking at what you want to do, you really want to make sure that you're not pulling somebody's identity away from them. That you're not just going in, we're going to get rid of all of this stuff, because then they feel completely lost. So that, there we go. All right. This is my favorite one. I read this one. It was like treatment for hoarding. Individual must be engaged in treatment. I don't know if any of you all have told somebody that they need to clean out their home or it's going to be condemned or anything like that. And their engagement in the treatment, it can be very difficult. What that ultimately means is that they are engaged in having a conversation with you. If they even crack that door open to start, that's the beginning process of engagement and treatment. And it's how we do that porch approach, right? So if I go, rarely have I gone to somebody's home where they open the door wide and they're like, come on in, you know? Sometimes it's just a crack in the door. Can I help you? And it's like, yes, we had an appointment at this time. And it's like, nope, I don't remember that. So sometimes it's just about, oh, just come out here. Let's just chat out here. And not asking to go in right away. Not trying to be like, hey, can I come, you know, can I come in? Let's talk. You know, just being like, hey, let's come out here. Let's just chat here on the porch. Let's just chat outside. Let's see what's going on. And so then you're not invading their environment and you're getting to know them and their thought processes, which will help when you go into the home and help be respectful of what's happening. But they do have to be engaged, right? If I have somebody that doesn't crack that door, then the city officials get involved, and unfortunately it becomes a lot less engagement as much as traumatizing for the individual. Treatment will be long and time consuming. I think that's everybody's favorite part that I say, because they think, oh, well, it's going to take a long time to sort and organize things, but it's actually going to take a long time to help that individual identify and discard all of their pieces, right? So when they are looking at what do I keep, what do I not keep, there's so many pieces that go into it, because you also have to do with the treatment of how do you stop acquiring while this process happens? How do you start organizing? And there is a lot of treatment that happens before they actually start discarding items. So that's that kind of piece, and I'll go into what those, like planning for treatment, I think that's actually the next slide, and those pieces. So we'll go into that. But so addressing, discarding, and acquiring. That's kind of one of those first steps that you want to identify. What are they acquiring to begin with? How do they acquire? And then how do they decide what they're acquiring? So if I go into a store and I walk in and I say, wow, that looks really, like that sweater looks beautiful. Kind of want that sweater. But then I have my thought of how much does that sweater cost? Do I really need another sweater? I think I already have 2 purple sweaters. Do I really need a 3rd purple sweater? Probably not. These are individuals that don't have those kind of thought processes. And what I tend to see even more is they struggle with free items. That's my favorite. When I see free items on the side of the road and stuff, I'm like, oh my gosh, wish people would not do that, because it's such a struggle. Because I get it, you know, it's free. It's like all of us have that instinct of free. What's going on? And so individuals that are attached to items are going to be more likely to pick those free items up. Or if it's on clearance, Goodwill, you know, $2 for this, $2 for that, 50 cents for this. Garage sales have a lot of that. This might be valuable one day. When I talk to people and family members, loved ones, friends, they're like, I think that they literally go to Goodwill every day and purchase the same items over and over again. And that's true, they do. They are very attached to those items. They've identified that those items bring them something in return. So that's what you're first identifying. What are you acquiring and how are you acquiring it? And let's start talking about the thought process when you go into a store or you see something on the side of the road. What's the first thought that comes to your head and how do you think through that? And so that's that piece where you start teaching them, just like I said, do I need a 3rd purple sweater? Is this really important to have a 3rd purple sweater? Helping them to kind of really go through that process. I worked with someone that liked brooms, which I didn't understand. And they would go in dumpsters and get like used brooms and collect brooms. And they go to the store and get brooms. And so it was like, okay, so help me understand. And it was really about like, well, I just want things to be clean, and brooms are very important to help you clean things. And it was like, okay, so let's just talk about that. So really kind of helping them understand what's leading to the acquisition of the items and then discarding them. So we'll go over kind of how we start teaching a keep pile, a discard pile, and how to kind of problem solve through that. But basically, you will have rules that will go in place with the individual that says, this is how many items that you can bring in a week. And so you have to really start to learn what's your priority of what you're bringing in each week to deal with that. So again, Boston University research, they did group, in-home, and online therapy. Online therapy is actually very impactful and is effective in working with people with hoarding. They don't have to allow people in their home, so they have their space. They kind of choose where that camera goes, which is okay. And so working with a therapist, so if you guys live in areas that are harder to get therapists that can do the cognitive behavioral therapy work with the patient, or you can't find a therapist that'll go in-home, but they'll do it from an office, this is a very important piece to know about, and that they can access treatment. But again, in-home treatment is really critical. All right, so an important to complete sort in-home sessions. So I can talk about these as much as I want, but if I don't sit down with the actual person to go through how they sort as they're sitting in front of their items, I may not truly understand what they're going through and how to help them kind of manage that discarding and what to keep and not. All right, and so a lot of times you're more of a coach than a therapist, which is great. For any of you guys that aren't therapists, you can do the coaching piece. And so I'll talk more about that because I know there's a lot of people in here that are not therapists. And so how do you take on the same type of role without doing all the cognitive behavioral therapy interventions? So again, I'll show you guys the clutter image scale. That can be used by anybody. It says CBT, but it's not a therapist tool. It is a scale that you can use to help the person identify how they see their home. So I'll show you guys pictures of that. Feelings and beliefs associated with the items, again, very critical piece. Planning the treatment. So when I say planning the treatment, if I go into somebody's home and they have boxes lined to the ceilings, clothes on the bed, I'm overwhelmed. I don't even know where to begin, right? So I can't imagine what it's like for this individual to go into the home and be like, okay, let's start organizing. Let's just do this, right? And I don't have all the people from TLC to help me out there either. So it makes it a little more challenging. So one of the pieces is how do we plan for that before we even are in that environment? So that, just going back to the 25 teddy bears, and I just like the teddy bear analogy because people collect different things, but it's an easier one to kind of sort through. So if I have 25 teddy bears and I want to help them start planning, I'm going to help them start making like priority lists, right? So let's identify 3 things that are the most important to you about those teddy bears, right? What are the 3 things that mean the most to you? What color of the teddy bear is the most important? What size of the teddy bear is most important? And then my third one might be how my teddy bear feels, right? So then we put these 3 rules in and we say, so you can keep the teddy bears and match all 3 of those. Or matches 2 of the 3, right? So then we start talking about it. Now you think of your 25 teddy bears, how many of those match what you just said are the most important things to you about the teddy bear? And so then you can start to kind of see, they'll be like, well, I might have like 3 or 4, I don't know. And so it's like, okay, so let's talk about what that means about the other ones. And so we start doing like a grieving process, talking to them about like the items that you have aren't as important as these 3 characteristics that you've labeled that are most important to you. So same things with mail, right? A lot of people collect mail. I am the first person when I check my mailbox, my junk mail goes straight into the trash can. And it's probably going into too many homes because they will keep junk mail like everywhere. And so really trying to help them identify what are the 3 most important characteristics that you're looking for when you pull mail out every day. So out of all these stacks of papers, what are the 3 things that you have to keep So taxes for the last 7 years, right? Or, and there's some other, just kind of helping them identify what is it else. Letters, personal letters that they want to keep. So helping them identify like 3 things of the papers and characteristics that are most important to them. And really helping them understand that like, you really acquire all of these because they feel good, but you've identified that this is the most important. So we're going to keep the most important because it's important for you to keep some of these. And we're not going to get rid of everything. We're going to keep some of it. So then you start kind of going through. And that's the planning of the treatment. That's before you even go into the home. Or it can be there at the porch, those kind of pieces. Exposure therapy, again, that's that being in the room with the items. How do they feel when I go to discard this item? What's their response? Downward arrow. This is my favorite because this is what really helps you pinpoint what's behind the individual. So the downward arrow is where, okay, if I get rid of this teddy bear, what does that mean for you? And they start to say, well, I feel like, you don't care about me. You don't care about what, about my feelings and thoughts. Okay, so if I don't care about your feelings and thoughts, like what does this say about you? And so you just kind of go through this downward arrow of like, as they talk about me, so they might put the impact on me, right? I don't care about them. But then you ultimately get to the core and their core belief system, which is I'm not important. So me getting rid of that teddy bear goes to a core belief that they're not important. So that's what I'm really dealing with. And so being able to understand that and the downward arrow, asking that question over and over as they keep responding kind of helps to get that. Thought record, it's about 10 sequence of questions. They actually have these online. You can get the worksheets for them. They're like specifically 10 questions that go through a thought record, and it helps people understand their core beliefs and their belief systems behind why they're acquiring items. And then you want to have a maintenance plan. So this is really important. Part of my treatment is that maintenance plan. So that goes back to what we were talking about, the acquiring of items. How do you acquire? How many are you going to acquire? And we're going to set that rule in the beginning. We're not going to set that rule after everything's out of the home. That's like the rule that we start off with. What are you acquiring? How are you acquiring it? How much can you acquire a week? And what do you have to discard every time you acquire something? So you have to have those rules in place, and that's your maintenance plan. All right, so this, it's kind of small, but this is the clutter image rating scale. So if you guys look up here, there's 9 different scales of this. And it kind of shows, the first one shows, can you guys see that okay? No, I know, I was like, I thought it would be bigger than that. I don't know how to make it bigger. Might be easier to see on the sides there, but the first one is a clean room, right? There's really nothing in the room except for the lamp, the desk, the chair. The second one has a couple more things. You got some papers, magazines on that. Third has a few more items that are out. And so it kind of goes on and on until that 9th slide is you cannot see anything in the room other than the pile of clothing. So this image rating scale I have found so helpful when I say, when you look at your living room, which one of these pictures best depicts for you what your living room looks like? Now, this tells me the level of insight, right? So if I have somebody that tells me that they think their living room is a 4, but I have walked in and it's a 9, then I know the individual does not agree with me that they have as much of a hoarding problem, and that's probably what's causing them a lot of distress because everybody's like, you have to clean your stuff. And they're like, it's not that bad. I do not know why I have to get rid of all of this stuff. And it's because their perception of what they have is a lot less than what you and I see, and what family members see and loved ones see and friends. So using that scale just gives you an opportunity to talk through, okay, so you think that your house looks like a 4. So let's just talk through like, what are the pieces in 9 that you don't think you have? What are the pieces in 8 that you don't think you have? And you kind of go down to see why those don't fit for what they see for their home. it's always good. You know, people don't call you that there's a hoarding problem when people are at like a 4 and a 5. That's just my house on a bad day. I have 3 kids, so sometimes my house does look like that at the end of the day. But no, and so the 6 and the 7 and the 8 and the 9 is when you start to have like family intervention, people that are concerned. It's usually about the 6 number that they stop letting people in their home. And that's where you start to see kind of that isolation happen. And it is a progression, right? So it's not like if I go from 1 to 9 in a 6-month period, unless I have had a psychotic break, then I might go from 1 to 9. But not usually, because they don't acquire that much stuff. It's just usually messy. So this is a very helpful tool. Then I'll show them a bedroom scale, right? So here's your bedroom. So then if they say, you know, I'm a 4, and I'm like, oh, okay. Well, it looks like you still could sleep on your bed at a 4. Are you sleeping on your bed? Well, no. Why aren't you sleeping on your bed? Well, I can't get to my bed. Okay. Well, let's just talk about that then. Let's see, like we've got a 4 where I could still sleep on a bed. It might be a little hard. I might have to push some things over, but I can still sleep on it. At what point on these pictures do you think they stop being able to sleep on the bed? And so that you can kind of help the individual kind of walk through those clutter images to help them identify where they're at, right? And so that'll lead them sometimes to be like, okay, well, maybe I'm a 7. And then you start to have some insight. You start to have some insight into, okay, maybe this is more than I thought it was. So the clutter image rating is very helpful in that sense. Let's see. So this is one of the pieces that I do like to talk to about for individuals. So as a therapist, me going into someone's home and saying, okay, let's do this, is usually not super successful. There usually is a second or third party that has gotten involved before that they'll let me in the home, right? So it could be social services, it could be adult protective services, it could be the health department, it could be a lot of a landlord. So I originally started doing trainings for hoarding with landlords. They're the first ones to identify hoarding problems. And so I used to do that for CHAFA every couple of years, just to kind of help them identify when they're starting to see warning signs for that and how to get the help that they need for that. So people, of course, get evicted for these pieces. They lose their housing. Their homes become condemned. There are so many things that happen, not to mention the loss of family support and friends and loved ones. So through this process, people lose a lot of things. They lose people that are important to them. They lose their housing. They lose their belongings, all of those kind of pieces. So really kind of helping them roll with that resistance and helping them understand the importance of going through this. There's two people that I always like to have involved, and that's like the enforcer and the support. So I used to work a lot with adult protective services, so APS would go in, and I would go in kind of as the clinical person and work with them and being supportive, while APS was working with me to be supportive. But they would also be the enforcer to kind of keep the reality check in, right? So I can be nice and loving and like care about all of your items, but at the end of the day, we have to make decisions. We have to start discarding things, or you're going to lose a lot more than just these couple of items. And so really kind of helping them to identify that. So it's really about rolling with the resistance. What I have always found, and even though it says enforcer, they are not less therapeutic, right? So all the people that have those kind of landlord, police, those pieces, I've always found them to be so supportive of the individual. Really, they kind of get to a breaking point sometimes with the individual that they're like, this has to stop. But they'll like pull it back and be like, I just need you to, I mean, I have to legally take your things away. I have to legally do these pieces. And that's the enforcer piece of like, there needs, sometimes has to be that consequence, right? If I don't have a major consequences, how likely am I to make a change? So if you have people that have this hoarding to a level that it is dangerous, or getting to the place that are dangerous, you know, they may need that enforcement to have enough consequence to want to make the change. Goal is, I think, that we always kind of get in there before it gets to that place. But again, I think what we find a lot of the times is people don't ask for help before it gets to that point. People don't realize how severe it's gotten, but sometimes they do. And when they do ask for help, you want to jump on that immediately, because it means that they have identified that they need help. And it doesn't mean that they're at this level, but they know they need help. They've listened to their family or friends that have said, wow, this could be a problem, right? So there's a lot of things that can go in that. But rolling with the resistance is really important, and using that enforcement even as a supportive role to go back to when they start panicking, right? Because they'll panic, they'll be like, oh, don't take that, no, we can't take that. So you want to be very careful that you're not removing items, unless it gets to a point where I've had to do that, where it's like we have to actually get everything out of the home, and you don't have a lot of say in that because the home's going to be condemned. And that's a lot harder to work with, and that's where you absolutely want to get a therapist involved as the person's going through that, because it's a significant loss for them to just stand there and watch things go out and not have a say in what's happening to items leaving their home. And so they really need to grieve, they need to work through what is happening. And what I will tell you, if you do work in code enforcement or anything like that, and you go into homes and you guys work on cleaning out those homes and you don't address what the problem is, you will be back there in 6 months. And so that's the piece, is cleaning the home does not fix the problem. So just kind of working with your local individuals. I just managed to find the enforcers just naturally through meetings I went to and community networks that I had that were able to kind of help in these roles. One of the things that I did a lot of work with was for families with social services involvement. So again, it doesn't just happen with the elderly, and it happens with people of all ages, but there are a lot of families that will have the hoarding piece. And so social services will sometimes get involved, and they'll want to remove the children from the home because of the unsafe environment. And so when you do that, you work with the parents and the kids, because the kids have also learned the acquiring skills. You rarely have a child in a home like this that's like, yeah, I don't want any of this stuff either. Come and clean all this out. No, they have the same kind of pieces that they're like, they have now put attachment to items just like mom and dad have. They're collecting things over here just like mom and dad. But what I have found to be really helpful is that children are resilient and they're able to make those changes much faster than us as adults. And so I start to utilize them as being kind of the incentivizers, the ones that's kind of, they get into a game of it, they like to make it kind of fun. We do color coding of sorting and organizing and organizing their closets, things like that. There's an end goal for them of like a really exciting thing. If the house gets cleaned by this, then the family and us come up with a reward system that will be in place. And when you do that, the kids start to really get involved and they start holding mom and dad accountable to it, which is really kind of fun to see. And it has some sustainability with that, because they're like, this feels really good and I've now learned how to do this. And so when mom and dad start doing these things, I can ask those questions and I can talk about what are our goals to keep our house in line, that we can go to, Water World at the end of the summer if we keep our home clean and those kind of things. So yeah, anyways, rolling with resistance. So ways to help without cognitive behavioral therapy. So whenever I would go into a home, like if you walk into a home like this and me say, okay, let's clean this room, we're all going to be overwhelmed. I'm going to be overwhelmed. I might have a panic attack. But instead you go into and you're like, okay, we're going to choose one section of this room and we're just going to start there. So you go to a corner of a room, you let them identify the corner that they want to go to, and you have 4 bins. You have a keep bin, a trash bin, and a recycle bin, and a donate bin, okay? So you have all of these bins, and you talk about the importance of each bin, right? So my keep bin are the things that fall into what we already talked about as your 3 most important characteristics of this, right? So, if it's clothing, what size are we going to keep? What are our 2 sizes that we're going to keep, and what type of clothing are we going to keep? So when you go in, you have to have those 4 bins. And the rule is that you cannot fill the kept bin before you filled all the other bins. So going in and being like, oh, well, let's just keep filling the keep bin, no. So I would take 15 items, and that's really where I start. I'll take 15 items, and I'll be like, okay, so out of these 15 items, you can keep 4. So identifying 4 of these 15 that you can keep. So let's start talking about, like, what's the most important of these items that you're going to keep. And then the other ones are going to go into one of the other 3 bins. So that's how small you start. Sometimes you start at 10. Sometimes it depends on where the individual is at, right? And then after they've identified the ones that are kept, you just start organizing and sorting where, okay, so which one of these things are still really important to you that we could donate that somebody might find value in? Because there are people that will find value in it, and you can talk them through about giving that to another person that will actually enjoy it. But then there's a lot of things that are broken, they're not any good anymore, so really talking them through recycle versus trash. So some people feel better putting things in a recycle bin than they do a trash bin, because they're like, well, at least it'll get reused somehow. So if it's recyclable, you want to do that. You want to talk them through the reuse process of it. You want to talk through the donation. Like one of the families I worked with, one of the kids, it was really hard going through the toys and like kind of identifying, even though like half the toys were broken and all of those pieces. But some of the most important toys after we did the kept is like, how do we donate these so other children can really love these and enjoy these just as much as you love them, and just because somebody else has it doesn't mean you love it any less, those kind of pieces. But anyways, the organization helps a lot in teaching, and basically what you're doing is you're teaching them. You're teaching them that organization. You're teaching them that problem solving and sorting. That's the critical piece. If we don't teach them how to problem solve and support, the sustainability of it is just not there. If I am not fully invested into the process as the individual, then I don't really learn how to keep and discard things in a regular basis. So then you start out with that kind of keep, discard, those kind of items, and you do like 10, and then after a week you go into the home, maybe, so I'd go in the home maybe 3 times the first week, and we'd do 15 items each time. And the rule was that if they wanted to bring anything new into the house between when I was there, then they had to put it in a specific part of the house, and we had to talk about it each time they brought it in. But the goal was for them not to acquire anything during that week. It was just for us to organize. And so at the end of the week, then I would give them homework, right? I would say, okay, at the end of this week, when I come back on Monday, I want to see that you have sorted through 2 more piles of this, okay? And then, usually I'd start with 1 pile on the first homework day, because it's very, they get looped. So they start looping in their thinking. And I think that's where the obsessive compulsive thought stuff came in, is because they start looping and they think, well, I could keep this, or I could not keep that. Because, I might need this, I used it like a couple of years ago, and what if it happens again that I need, and so they start loop thinking. So that's why you keep it very small and compact. You need to pull 15 items, you keep 4, and the rest you kind of organize, okay? And so you just give them that assignment, and you come back in on like 2 or 3 days later, and you go, how did that go? What are the, and the most important thing, sorry, I forgot this. When I have my trash and recycle, those go out the door with me every time. Do not leave those boxes in the house. I will tell you, they will be back amongst other items when you come back in a couple of days. So you actually have to take them to the trash and the recycle bin for the individual, because they're just still not ready to let it all go. So it goes out the door with me, and the donation pile goes out the door, and I go take it to Goodwill or wherever I'm dropping it, ARC, any of those kind of donations. And I try to make sure, really talking through, if somebody wants to donate something that's like maybe broken or something that doesn't have value, really talking through like, it's kind of broken, I'm not sure that it can be used again, those pieces. All right. Again, you're teaching them to think twice about so by me setting rules with them of like, if you bring anything in your home, we're going to put it over here, and you and I are going to have to talk about it. We're going to have to talk at length about what you brought into the home. that makes them think twice, right? If I go and see like these things sitting on the side of the street and I'm like, those are free, but Heather's gonna be there on Monday, and I don't know if I wanna explain to her why I picked those up. So, not always the best way, but it works for a little bit, and then you want them to start having that thought for themselves, right? But sometimes that external piece, if you've formed the right relationships with them, helps them to be like, yeah, I don't want to be held accountable or asked why I'm keeping these things. And then again, when they do bring it in, it's not punishable. It's just like, hey, let's talk about what was going through and when you saw it, what you couldn't resist about going and getting that. And then as they do this so by week 2 into week 2, each day they need to be pulling aside 15 items and doing that. And so some of the rules that you can set in place, because it is helpful to have rules, right? I'm a rule breaker, so I do struggle with the word rules, but I know that sometimes I need a rule to kind of keep me in line, keep me in check. And so rules just help to guide them, because they're really kind of overwhelmed by everything that's going on. And so it's not like, oh, you have to do this. It's like, okay, let's create these rules together. Let's identify what they are. So let's talk about why you would keep items that you hadn't used in over a year. How many of you guys have that rule in your home? If I haven't touched it in a year, it's gone. Yeah. So a lot of people do. A lot of people don't. And that's okay. And that might be more severe of a rule than the person can handle, and that's okay. You talk about it. You talk about what are the rules that we're going to put in and what are rules that they can live with, right? If I've never disposed of items in a year, and that's just not something I'm ever going to get to, I don't think my mother would ever get to something of disposing items she hadn't used in a year. But we will talk about other things that she's willing to put in as rules. The other one that can be Ohio rule is if they've only handled it once, right? So if I haven't ever handled it, that should be a rule that I don't need to keep it. If it is literally sat here in my home and I have never ever used it, I really don't need it. And so helping them to understand that. I understand that you might need it, but you've never needed it. So let's talk about that. And if they can't do it, then you sometimes need family to come in. So I've had to also get family interventions, children, friends, neighbors, where after a couple of weeks of doing this, they're still really struggling. So then I have the neighbor partner up with them and do it with them for a couple of weeks. I give a little education on the neighbor of not ever being like irritated with them and minimizing their items. And making sure that they're not doing those kind of pieces. And I'll be like, if you need to take a break, go outside and take a breath. But you're only doing 15 items a day. And so if it's taking you more than an hour with your friend, then it's probably too long. Give me a call. And so 15 items they should be able to go through in an hour, especially after we've already taught this sorting stuff a couple of times. So these are all things you can do as a non-therapist. These are not therapeutic interventions in the sense that you have to have a license to do these. These are all things that neighbors, families, friends can all do. Let's see. All right, so how to help someone purge. So again, it's that prioritizing list prior to being in the home. So that was my example of the teddy bears, the colors. Prioritizing rooms, like what room are we going to start in? And I let them, it's very important that they have a say in this process. This is not me cleaning out their home. This is about them reorganizing their life into a way that it's sustainable. So we're going to start by prioritizing where do they want to start in the home? Where are they most distressed by, right? So the woman that collected mice was most distressed by her kitchen. So that was where we started. And not being able to eat in their kitchen and not being able to cook in their kitchen. This was somebody that loved cooking. It was something that they really enjoyed doing, and they hadn't cooked in 10 years. And then once we got in there, we realized that wires had been chewed through, and now they couldn't cook, and the fridge was, nothing was working. So we had to, problem solve and get appliances and other things like that down the road, but it didn't happen right away. So again, start in the section of the home, focus on a few items at a time, the donation, keep, trash, and recycle. Choose your, keep your bins, choose them. They should be about the same size, all four. And then I like bringing bags that I put them in so I can put them in my trunk and take them. with me to the different places, and then I leave them the 4 bins with the keep, and I like write on it, keep, trash, recycle. Again, problem solving and sorting. So like sometimes it's as simple as starting out with a stack of mail, of like, okay, let's go check your mail at the mailbox. And we're gonna talk about, like, especially if people like acquire paper. And so I'll have them pull out their mail and I'm like, okay, show me how you sort your mail. And it provides me a lot of information. Like, so some of them will like move stuff into piles and then they'll move them back into another pile. And then I know they just don't have the sorting ability, right? They're like, oh, but I could put it over in this pile. And it's like, not sure why you need more than 3 piles in a mail. You've got your junk mail, you've got your important mail, and you've got your like loved one's mail, right? So these are the things I want to read. These are my bills I have to pay, and this is junk mail. But they'll move things and they'll create like 6 or 7 piles and move them around. So it is really about, okay, so let's just really talk about the organization of mail. Magazines are a whole nother piece. And so usually it's like, if you keep a magazine, you have to get rid of another magazine. So you cannot keep a magazine unless you get rid of another magazine. Celebrating and recognizing gains, that's really important. Just like what I talked about with the kids. I think one of the kids, they were gonna do a garage sale at the end, or they did a garage sale at the end, but that was their reward. And with that money, I'm trying to remember what event they had, but they had planned a special trip for the whole family to go on, and they had to make a certain amount of money from the garage sale to go on that trip. So that helped them to really decide what they were going to sell. Like, instead of donating, they were selling in their garage sale. And so that became a very exciting thing for the kids. Oh, well, I don't need this. I can get rid of this and make some more money so we can go on this trip. So different pieces like that. And then also when they'd be at the store, it would keep mom and dad from acquiring things, because it was like, well, if we spend that, then it goes away from our money for our trip. But yeah, definitely doing the celebrating of, this is fantastic. Oh my gosh, you sorted all 15 of those all by yourself. That is amazing. You didn't even need any help with that. Let's talk about what that went through. And again, so along with the celebrating goes grief. And celebrating that they made it through how hard that was. That was not an easy task to do. Those 15 items was not something that was super easy. If it was that easy, you would have been doing this the whole time, right? So this was a very, very difficult thing for them to go through. So how that grief feels for them, and asking them, how do you feel? Like, what's going on? What are the negative feelings you're having right now? What are the good feelings you're having? And then educate them about the new addition. So that's just that acquiring piece. So one of the things too is safety is really important on here. Is the home. So like the woman that I work with that collected mice, it was a safety hazard. There was mice droppings everywhere. Had to be very careful about like how I went into the home. I did wear booties when I went into the home, so I did keep some things. I always had like gloves in my bag. I never did the sorting with individuals without gloves. And I'd give them gloves. So I share the gloves with them, right? I'm not gonna just put gloves on, because that's just insulting, right? I'm like, we're gonna get dirty today and we're gonna do it all today, just like we do. And I like to clean with gloves. Do you want a pair of gloves? That's just how I present it. And so then they're like, oh yeah, I'll take gloves. And sometimes they'll be like, no, I don't need gloves. Okay, well that's just who I am. I like to have gloves. And they'll usually, they know me by then, and so they're okay with that. But making sure like the booty piece, especially if there's like lots of animal pieces, like so cats. I've also worked with somebody that had lots and lots of cats. So you have health hazards and risks that go into that if there's a lot of feces stuff in places. This is an example of a home that would have health factors, right? So you'd want to wear a mask. Now, these type of situations, I am probably not going in and doing therapeutic interventions at this point. This is where the health department's coming in, other people are coming in, and we're discarding the things from the home. And we're doing it pretty quickly because we have to, sometimes this happens after the individual is hospitalized for a reason, right? So I think there was one time that I did go into a home that was like this, and it was only after they got hospitalized that there was information that came out, and I went with the code enforcement. I think I went with the fire department to the home, and it was very similar to this, and it was like, oh my gosh, this person cannot safely come back into the home because they've now been hospitalized, and they're gonna be in a wheelchair or other kinds of a device that if they're gonna come back to the home, they have to have. But the goal is always to get them back in their home and to stay in their home. A lot of times, unfortunately, I've worked with individuals that they had to go to assisted living, nursing homes, through this process, but it was their choice a lot of the times, where they were like, this is just too exhausting for me, and they make those decisions. But I'm still going to talk to them about acquiring things, because people still can acquire things in retired communities, in assisted livings. I can tell you I've gone into assisted livings where the owners are like, I'm going to kick them out if they don't stop bringing stuff into this house. So you still have to work through those pieces, and you don't just think it's fixed because the person doesn't live in this house anymore. So again, the safeties, sometimes they're uninhabitable. They can carry diseases, use gloves, booties, things like that. And again, long-term solution is not to quickly clean it out. So if I'm working with like a loved one, I can't tell you how many times people come to these trainings because of actually a loved one and not so much just for work. And so they're like, I have a parent that is struggling with this and other pieces. So just remember, it's very easy as a child to want to go in and reorganize my parents' home. And to be like, okay, I'm going to do this. So think about that too with individuals you're working. If you're going to get family members help, sometimes those family members don't have tolerance for it, and they just want to get rid of everything because it has no value to them. So it's important that just because it doesn't have value to you or to the family, that they're talking through that. So the person that is acquiring the items has to be fully engaged. That's the most important thing to remember. Them standing or going away and somebody fixing it for them is not going to solve the solution. And it'll actually increase their depression, it'll increase their anxiety, and it'll increase their isolation if those things are not into consideration. So yes, if you want to help your parents and you want to help your friends or people that you care about that you see with this, just think about teaching them how to like sort and what's important to them, right? So if you go into the home and it's like, so I see that you collect 500 glass swans. What is that about? Like, help me understand, like, why 500? What do you like most about the swans? What are the 3 things that are most important to you? Like, you can almost do this with a parent. Like, what are the 3 things that are most important on the swans? Well, I really like the swans that have this and this. Okay. Is there a way that we could maybe donate some of these swans that don't have those things? And here's why. And so working with your family members on that. And again, sometimes it just happens really quickly. Resources. So there's a couple of pieces on here. I think I have, ColoradoHoarding.com is an organization kind of where, I think it's like a chat room, I believe, or it's like where professionals come together and talk about where you can get resources. Colorado has some hoarding task force. So some of the counties in our area have task force involvement, and that's the most important thing, and that's really where you want to start. Whatever community you're living in, you want to first identify, do we have a hoarding task force in this environment? So if I have a situation and I've identified an individual that needs support through this, is there support already within my county that I can utilize? And I have worked with a couple of task force, and they can include anything from adult protective services on the task force, coding inspectors on the task force, firefighters, all kinds of emergency personnel, therapists, and truthfully, just like some people in the community that are just passionate about hoarding, and they're passionate about helping people that do hoard. So, look in your community. If you feel like, and you work in like kind of city jobs like APS and stuff like that, see if you can formulate task force. And I think that the ColoradoHoarding.com helps you
to identify and connect with other hoarding task force in the area so that you can get ideas of how they did it and how they got it to start and how they got it to work. But remember, it is a community effort. It's not a one-person effort, right? So as a therapist, I wasn't able ever to do one of these successfully by myself, right? It was a whole community effort. It was family members, support systems, myself, sometimes other enforcers, and sometimes other therapists, because it's a lot of work to go into the homes. I also added on here a hoarding disorder group education. So this is actually, East Coast has a lot of resources on hoarding, and I think a lot of that, the Boston University, you've got city living where people are living in tighter spaces, so it becomes much more predominant in those areas. But there's a whole education group, and they actually travel around and do hoarding trainings of all different kind of categories, like specifically, I think there was like 16 different types of specific hoarding trainings that they do. And then I think I added Jennifer, who I think is here today. I put her website on here because I've worked with her in the past on cases on the clutter truck stuff. So, yeah, so those are my resources and then references. These are some books. If you guys get that treatment for hoarding disorder, if you are a therapist, it is very helpful. And if Rolling with Resistance is also another really good one. And one of the most common ones is the Hoarding Handbook. And it's a guide for human services professionals. So it's not like a therapeutic manual. And it's, and I have it, and I didn't bring it today, so I'm sorry. But I find it very helpful because it has like different interventions to do, and it's just a handbook that is incredibly helpful. They guide you through what to do. So those are some of the references. I talked really fast, so I guess my time happened quickly. So any questions, comments, things people want to add, especially around resources? Oh, question?
Hi, so I do have a question. I know that many of the services, but what if you are working with a client that is not financially able, because I know factually that these services, some of them are not free. So if you have someone that, let's say, needs a dumpster or something like that, how do they get that support? Because I've had a client lose their home because they could not afford to get the dumpsters and things of that nature so that they can clean their home. So what type of resources do you have for that?
Yeah, so the question is, what type of resources do we have for individuals that cannot afford different things? So sometimes you have people that can't afford reorganization things, so can't afford bins to reorganize their items into, can't afford a truck to come and discard their items. So items are the trucks that do that are incredibly expensive. I have worked with some places in my community and talked to some of the smaller mom and pop people that do the discarding, and so have been able to get individuals to volunteer their time and their truck for a smaller fee, because again, I worked with people that were on disability, so they had limited funds. And it was always a constant piece as a case manager that I just had to really know my resources in my community. So I spent a lot of time up in Adams County, and I worked a lot with a lot of the people in Adams County. I definitely work with code enforcement. I worked with APS on resources. We sometimes would just get a volunteer group that would come in and help to discard, and we'd rent a truck, and then we'd have to go and find a place to discard it safely, and then we'd pay that kind of dump fee that was a lot cheaper than having we got junk trucks come in, which can be, I don't even know if that's the name, I hope I didn't say a name, but those types are really expensive, so I usually just kind of utilize pooling a bunch of resources together to see what I can get. But yes, you're right. It is very challenging. That's why you want to hopefully get in before they're losing the place so that you can start. It's a lot easier to get rid of one box at a time than it is to get rid of a whole household. So I hope that asks. If you have a task force in your area, they will also have access to affordable resources.
So you had kind of mentioned that using that clutter image scale with the individual who's hoarding, and if there's an agreement on, yes, I am having a problem, and you kind of said, to jump on that right away, is there sort of a best practice for doing that? We've been dealing with a difficult client who's, there's a problem, but we're having a lot of difficulty getting traction and working with this person to clean it out.
Right. So the question, sorry, I have to repeat the question for this mic. So the question is, when somebody identifies they have the problem, that's like the first step. So what's the next step to actually get them engaged? Because sometimes they're still not ready to engage in treatment just because they've identified there's a problem. And so that's, again, from a therapeutic perspective, I look at motivational interviewing techniques. But from a non-therapeutic perspective, is you're really kind of identifying with them, and that's that planning, right? So that's that sitting down. Okay, so we know that there is a problem. Let's start talking about pros and cons. Let's start talking about where that problem is. You've identified it's a problem. You don't feel it's too severe yet, and we're not going to go that it's too severe, but we need to start doing something now. And so kind of sitting down with them about why they feel that it's a problem and why they're ready to do something, and what are their barriers to doing that. So if we go into your home and start sorting things, what are you afraid is going to what are you most fearful of? So I always like to use questions that are like kind of on the extreme scale of things. What's the worst thing that's going to happen? Because if I phrase things like that, I start to really get down to the core of what they're most, like what they're afraid of. Well, if the worst thing could happen is that I could lose all of my things. Okay. Well, we've just talked about organizing your things, and never is it my intention that you would lose all of your things. That would be a horrible thing, to lose everything. We want to actually keep you from losing everything. And so, let's talk about what that is. So you got to get kind of what's their worst case scenario. If you don't start addressing this, what do what's the worst that could happen if we don't start doing this together? So you start using these kind of catastrophic questions to help them start generating thought process, and then you kind of bring them back of how you can help them that it's not as catastrophic as that, and that's not where we're at. And so those things aren't going to happen right now. So that's what you believe on this end, but that's not what we're talking about doing. And we're actually going to do things so that never happens. So you're just kind of getting into their belief system is the best way. But it is hard. It is hard to get them to say, come on in. So that's where you start the planning, making lists, writing things down, how they start organizing, how they acquire things, what's the feelings that they have behind the acquisition of stuff. So.
There we go. Wait for the mic.
I'm working with 2 veterans that are both retirees and on Medicare. And I'm wondering if there is coverage for the mental health piece under the VA medical that's TRICARE for Life, covering therapies that have to do with hoarding.
So the question is, does TRICARE cover hoarding? The good thing is it's in the DSM-5. And so if you do, I think the hardest problem that you will have is having somebody that is in network with TRICARE also have skill sets in doing hoarding. But that's why you might actually look at the online piece. So there's people on the East Coast that may take TRICARE because it's a federal insurance, that they might be able to do more of the onlining CBT with them so that they can cover. Because you can bill for the services of doing the mental health piece because it's a diagnosis. So they can bill. It's just a matter of finding a therapist that's in network with TRICARE.
Do you have an experience that
The people that are in network with TRICARE? No, because I have not worked a ton with veterans, so I don't have a specific resource right now. But you could contact TRICARE. So TRICARE also, I know HealthNet is under HealthNet now, and they have, you can contact the HealthNet to see if there's a provider in the area that does work with cognitive behavioral therapy hoarding pieces. And so any veteran can call and try to get those resources. And if there's a network provider, they will provide that. It has been my experience with HealthNet for other conditions. So.
I would like to know if I'm like a storyteller, so I've used that as kind of a tool to get people to kind of come around. So when you talk to people, do you ever use like if you walk into a place that's, a 9, do you make them feel comfortable and say, oh, this isn't the worst I've ever seen? Or do you minimize how bad it is in order to get them to come around? Or does that make you lose your edge?
So that's a good question. Do I do stories and kind of tell the people that I'm working with, prior patients I've worked with? I think I kind of fill it out. I'm a storyteller too. So that's kind of my response as a therapist in a lot of ways when people are like, oh, I get so angry. And, so I use that almost as a therapeutic intervention in my natural therapeutic way. I don't know, though, that I've ever minimized what they had, but I don't catastrophize what they have either. So I don't want to minimize it when it's a 9 because I want them to know how we need to kind of move through this and get there. But I normalize that I understand how they got there. Like, I understand how it got to this place and how scary it must be for them to think that they have to get out of this place. And so that's probably more of what I do when it's that extreme versus when I'm working with hoarding. I don't use my stories as much with the individuals to kind of help them feel normalized. I really just normalize that they've gotten here and how they got here. Yeah. Because they're already minimizing, and so that's why I try to be careful with that. Sorry, that's my explaining, because like a lot of times they're already minimizing it, so I don't want to actually enhance the minimization, and that's why I do that. Sorry. Yes. Okay. Go ahead.
I'm wondering if you can speak to the difference in working with people with brain injuries and addressing hoarding as opposed to people without.
Yes. So I have not specifically worked with people with brain injuries. In hoarding, I've worked with people with brain injuries for other pieces. I think it becomes much more complex because sometimes, depending on where the brain injury is it a memory? Like, what do they have? No frontal lobes? Or are they very impulsive? Those kind of pieces. But it's the same that I would use with anybody with traumatic brain injury, right? So a lot of cognitive behavioral therapy, repetition, kind of helps things get in and helps them to become a part of their routine, would maybe be where I would go with somebody with the brain injury piece versus like the emotion and feeling piece. I might not spend as much time on their grief and loss because that's probably not what's actually causing the hoarding pieces as much as it is kind of like the lack of sorting and prioritizing and thinking through and problem solving. So I'm just going to teach them over and over again how to do those problem solving pieces and just go boom, 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 and do it again and again and again and again. And so that tends to be what I do with people that I've treated for traumatic brain injury. Yeah.
Hi, I work with elderly people who have been victims of crime, and we treat a lot of trauma. You mentioned one of the factors of hoarding was trauma. Is there a big correlation between trauma and hoarding, and does the trauma get addressed during this therapeutic process or before the therapeutic process starts? How does that work, or have you not worked with people who have trauma?
So, yeah, no, that's a great question. So do we see people with trauma? Do we see it a lot more with people with trauma, having hoarding disorders, acquiring things? Yes and no. I think just like any other trauma experiences that people have, the reaction to the trauma is different. When I do see individuals that have major trauma and they're hoarding, I spend a lot more time on like the feelings and the grief and loss piece, because they have, I want to make sure I'm not re-traumatizing the pieces. What I tend to see too with that is a lot more attachment and safety that they find, and so they identify with that. I do not do like EMDR training, and I probably wouldn't send them to an EMDR therapist during this process. I might do some more resourcing with them. So that's kind of that first stages before people start doing like major trauma therapy. They start doing resourcing, which is gaining coping skills and things to manage distress, right? So that's my biggest thing, is I want to reduce the distress of an individual that has major complex trauma while I'm going through items. And working with them on that. So I'm going to really probably spend more time with them on the coping skills around how they feel, and how do they tell me when they're starting to feel that distress? What are they going to do when that distress happens? How are they going to get safe again so that they can get back into their frontal lobe and out of their fight or flight spot? So that's kind of what I've worked with the trauma piece, is just kind of really talking about, this is going to be there's going to be moments of it that you're going to be terrified. There's going to be moments of this that you're going to want to panic and you're going to want to run. So let's talk about this before we even start the process of what that's going to look like. And I'm going to do those interventions with you when we start to see it. And you're going to have a safe word for me, or you're going to have something that we're able to do and we're able to stop and go take a break, or whatever that may be. Yes.
When dealing with people who have infestations of things like bed bugs and lice or whatever, are you still going to recommend only pulling out 15 items a day?
Yeah, so I have worked with people with bed bugs that have, yes. So it depends. Because just because somebody has bed bugs does not mean their home is at a 9. So again, it just kind of depends on the level of the hoarding. I've gone into homes that are clean with bed bugs. So the bed bugs in and of themselves don't kind of drive what I do on how I discard the items. I would say that I do move quicker, because we need to get them exterminated, and they're going to have to lose a lot of their items. So a lot of the things, if they have major infestation of bed bugs, they're going to lose anyways. They're going to lose their couches, their mattresses, all of those kind of pieces if they have major infestation. So that's probably what I'm going to focus on more, is what do we have to get out of the house for them to come and do the bed bug sprays. To start treating it. And that's, again, that time with that rolling. So I've done that a couple of times. And then Forster was actually the Terminex guy who came in and was like, you can't keep, these are now uninhabitable items. And so that was where it was like, we actually can't keep these items. They're not, he cannot get the bed bugs out of them, no matter how much he treats that. So let's talk about this. And so that helped, because the Terminex guy became my enforcer, and we were able to kind of move things along. So yes, I think it just depends on the infestation, the level of pieces, but you do have to move things out quicker. For clothing, I would say, we went to a laundromat, and it was like, you only have so much money for the laundromat to wash all of these clothing, so let's start paring down what clothes you're keeping and not. So that we're not taking these giant piles to the laundromat, because we don't have enough money for that. And so then it did help them quickly sort through what they were keeping and what they weren't, because we did have to wash them in hot water. Yeah, okay, yeah. All right. Any other questions? Anybody? Oh, yes. Huh? I have to repeat it anyway, so you probably could.
A big form of resistance that I commonly see is a client stating, well, I'm saving this because I know there's one more of this set somewhere.
Yeah.
Or they will say, well, I know I can fix this.
Right.
Or I know if I find that other thing, well, then I can fix this set. So what CBT techniques are you using, and what conversations are you having with those things?
Yeah, so that's where I actually use the downward arrow and the thought record piece. So I'm like, okay, You could fix it, and I actually believe that you can fix it. But let's talk about how many items we've gone through here of that you can fix. So like, is it realistic that you could fix all of these items? Or is it realistic that you are going to find a match for all of these items? So I don't actually say that in the beginning. I just kind of say, okay, so what does it mean for you if you don't have this anymore and you find the match? What does that mean about you? And so then that's that downward arrow piece, right? And they're like, well, it means like I could have kept it. I could have kept it. And so if you had kept it, what does that mean about you? Like, how does that impact you? What is your belief around keeping that and maybe possibly one day having the second piece? And you get them down to like their core beliefs and keep kind of asking that piece of like, so what does that mean about you? What does that say about you? And then once you get that, you kind of get into that core of like, this is actually me afraid of losing out on something, or this is me and my core belief of that I'm not, I'm missing a part of me. There's always like some kind of metaphor you can kind of get to with them on why they're holding on to things. If they're like handy and they can fix it, what does it mean for them if they give away something that they could fix, right? If I could fix that and I don't, and I give it away, what does that mean? What does that say about who I am? And if they're like, well, it means that I failed. Well, okay, so why does that say that means you failed? Like, it was an item that was broken. Somebody else gave it away when it broke. Like, let's talk about like what that means for you. How does that make you a failure? How does that make you feel like a failure? Like, and you're kind of doing that downward piece of why is that a failure piece? Because it's not. And we're going to talk about like how that's not failing. So I'm going to go down throughout that process of like, and so if you feel like a failure, what does that say about you? And so you're just kind of getting to that piece. You're feeling like you're failing at this. Are there other things that you're failing at? And that you're now attaching that value to the item versus like dealing with your fear of failure. And so that's kind of a piece that I do. And sometimes I do a thought record of that. But yes, it is always hard. And you always get that. You will always get that. I can fix this. I can find a match to this. I might need this one day. Those will be always comments that you get with every individual you work with. And so just talking to them through, yes, you might, and you might not. So if you don't ever get it, what does it mean? If you don't ever get to fix it, what does that mean? How does that feel with that hanging over your head that you want to constantly fix that? If you want to fix something, you have 10 things here that you want to fix. Let's choose one for you to keep. And after we clean this out and you get things organized here, you can fix that one thing. And then after you fix that one thing, you can go on to fix another thing. But we will not keep on to everything. We will hold on to one item that you feel that you can fix. So then you're not getting rid of everything they feel they can fix, but they need to choose one because it can take them a while to fix, and it gives them a goal to have that once you're finished and organized the house, you can start fixing that. But we need to not have 5 of them in the house because then you're never going to get to fix 5 of them. It's going to take forever and ever and ever. So kind of narrowing that down. But they need a goal, and so I like it when they want to fix stuff.
Hi, Heather. So I have kind of a set of questions in terms of saying a little bit more about kind of the frequency of your visits and the, kind of how long you work with people. Mm-hmm. And you've been talking some about goals, and what would you say, how do you know when you're done? And what's been one of your kind of, what's been one of your failures, and how have you dealt with that? And what's been one of your kind of best successes?
Okay. Okay, I have to remember all those pieces. So if I miss anything, remind me. So the question was duration of treatment and how long it happens, successes and failures, I think summed up. So duration of treatment, I would say that most of the time it is about a 6-month treatment process. And it's an intensive 6-month treatment process. So the experience that I have had is it's about 3 times a week. In that initial month to 2 months, you're going in 3 times a week. So it's really intensive. But your goal is that you're not the one doing all of the work. So that's why you're giving them homework every single time after that second week. And you give them a little more homework, more and more. And then you start stepping out a little more and more. So then I go to 2 times a week for another 2 months. And then I go to weekly for another 2 months as they sustain the kind of progress that they're making. It does take 6 months. It depends, like the 9s, those are hard. So when I talk about failure pieces, individuals that are at a 9, it is usually not my 10-item process. That's usually when I have had like, they have 30 days to clean up, or they have to get out, or they lose their home. And so then is a very different approach. And then I'm just trying to find as many resources as I can to get people to get the items out. And I'm just clinically working with that person on all of the things, but not actually sitting in the home doing the sorting and organizing of it. And then it has a maintenance piece to it. So after the end of the 6 months, I still go out every other week for a while, right? So for a year, I'm going to go out on a pretty regular basis, get down to like once a month, and see if they're maintaining it. And I've had individuals that start to regress, so I increase my treatments for a short term, and then I kind of step back out. But it's usually like by the end of that year, they've done some sustainable change. But again, they like constant. It is a constant intervention. So like Boston University, I think even wrote like, it is yearly check-ins or 6-month check-ins for like years after the fact, is what you can do. And so I think that that's one of those. My successes is working with individuals that were able to get their home into the goal state that they wanted to get them in within that year and maintain it. And me go out a year later and a year after that, and they're very proud of keeping it the way that they've kept it. Failures would be some of them that just couldn't and ended up in assisted livings because they just couldn't take managing that in their life anymore. Those tended to be people that had severe and persistent mental illness though too, so they had like bipolar on top of the hoarding or major depression on top of the hoarding, and just life became too overwhelming and they wanted that. So that would probably be a couple of those that did not end as well as I would have liked because they had a lot of potential to organize them. But ultimately, like one of them was like, you know what, I'm ready to disconnect from all of this stuff and I just need you to sell the house and help me get someone. And so I got the family involved and they came in and sold the home and got everything out. And so then I had to work with them in the assisted living on not acquiring new stuff. And so that's what I did. And I'm glad I did because I had another one that I did not do that with. And like 6 months into living in the assisted living, they got a notice that they were going to be kicked out because they had too much acquiring. So I learned my lesson on that one. And so, yeah, that would be probably one of my failures where I was like, oh goodness, we just cleaned out the place. And that was before I did a whole lot of hoarding stuff. And we had just kind of cleaned out, moved them in and thought the problem was solved because we moved them into an assisted living and it was not. So I hope, did I answer all the pieces? Okay. Yes.
Yes, I have a question about how are clients referred to you? Like, how do you acquire your clients? And what type of insurance do they have where they can afford 6 months to a year worth of intensive mental health treatment?
So it's a good question. I've only done my work. So she asked, like, how do people refer to me? So I don't do it in private practice anymore. I only did it through community mental health work. So it was through the capitation, Medicaid dollars of the intensive treatment with the individual. And so community mental health centers actually can provide those services if they have people that specialize in it. I believe there are a couple of community mental health centers in our area that do have, I know that All Health had one, and I think that Community Reach Center had one, because I know I've trained quite a few people in those, and we had started some groups while I was at those organizations. So community mental health centers can do that intensive group, or intensive work. Unfortunately, they only are able to do it when there's an enforcer involved, like social services, APS, they're about to lose their home, then it becomes beneficial for us to go in because they're going to lose their home. But there are private therapists that do it in the community. So Blue Cross Blue Shield, I mean, like your major insurances will cover it. I think the harder piece is finding therapists that do it in a private practice. There's a lot of therapists that do it for self-pay, and it's very expensive. But family members will pay for it sometimes in those cases. So working with like kids and stuff. But my favorite was working with the community mental health center because they were people that didn't have resources. And, you know, working and trying to get community mental health people onto your hoarding task force and advocating for that in your areas would be a strong recommendation that I would have. Because that's going to be your biggest way to successfully do that for individuals involved with APS, social services, and those kind of pieces, because they're going to, community mental health centers have more of those resources for that. Does that help? Me? No? Yeah, so online though, I've seen tons of online therapists that can do it. And so I have referred some people to online therapists, and it's a lot cheaper because it's online. So, and they don't have to travel, and you can find like rates and stuff. All right. Good. Okay. Well, thank you.